Selection of essential drugs. In this section, we'll be looking at how to select essential drugs. Remember, selection of essential drugs is part of the approaches that is important in the management of essential drug in the essential drug system. Essential drug management is the efficient use of drugs that are safe, effective, and affordable, and which satisfy the healthcare needs of the majority and cover prevalent diseases and conditions of the people. Essential drug management is the efficient use of drugs that are safe, effective, and affordable, and which satisfy the healthcare needs of the majority and cover prevalent diseases and conditions of the people. We can also define this essential drug management as a process that encompasses a systematic framework involving the selection, procurement, storage, distribution, and utilization of medications. So, if you look at this definition of essential drug management, it has to do with selection, procurement, storage, distribution, and utilization of medications. So in this section, we'll be taking the first step in management of essential drug, which is drug selection. That will be our focus of this section. Selection of drugs that are essential is the initial step because it involves identifying you as the healthcare worker, identifying and choosing medications that are important for addressing the most common health needs within the specific population or community where you are providing healthcare services. This selection of these important drugs is very, very, very important and critical as well that you take this step, because if you look at the markets, there's a lot of drugs. But if you go and purchase with the limited resources you have, drugs without considering those ones that are essential, you can buy drugs that will expire and without being utilized. As such, the resources is wasted. And such activities can delay or be a serious setback to drug revolving fund program where it's applicable. So giving an overview of essential drug management, we have to talk about selection of drugs that are important. And these drugs must be safe, must be proven to be effective, and these drugs must be necessary for the treatment of prevalent condition. As such, the selection process relies on evidence-based guidelines. There must be a guideline that is evident. Because over time, a particular community, there are conditions that are common in that area. So that conditions or diseases that are common would guide the selection of these drugs. Also, you have to consider the national formularies. That is, in a particular country like ours, there are a list of drugs that are needed or necessary. You have to also consider that. Then you also have to look at the patient outcome after using those drugs. So over time, these data would not serve as evidence that will guide the selection of these essential drugs. Another step that is essential in drug management is quantification, but this will be taken in another section. However, we'll look at it briefly. Quantifying selected drugs. You have selected a drug that is required. The next is quantification. You have to quantify the selected essential drugs. This step is to determine the appropriate quantities needed to meet the demand within a given time frame. You have selected the drug that you want to use for a month or 6 months. These are drugs we need in this facility for the management of these prevalent health conditions. The next step is quantifying the quantity that will be enough, that will not lead you to out of stock syndrome or expire. So you now take the next step, quantifying the drug. And in doing that, a lot of things are put into consideration, such as patient size, like population size you are serving, your health center is serving, or your hospital is serving. Dosage regimen. You have to understand the dosage and frequency of administration per disease. So in certain disease conditions, the drugs are taken 8 hourly. Some are taken twice daily. Some are taken once in a day. Some are taken twice. Some are taken thrice. You have to consider the dosage requirement. Then also, before you can move into quantifying the selected drugs, you also have to review the records of past consumption pattern, so you can determine the likely consumption. You know, in a year, there are seasonal variations. At a certain time of the year, there could be seasonal influenza, there could be diarrhea, there could be other disease conditions. So during those period of variations, a particular set of drugs would be needed in higher than the other. For example, if a particular community usually face diarrhea during the harmattan season, it actually means that during the harmattan season, that more ORS would be needed. So as such, you have to consider that. That is why you said you have to look at the historical data. Then, like we said, seasonal variations. So the three of them, these three set of criteria must be considered for you to now quantify the selected essential drugs. But this will be taken in full in the next section. Another step in essential drug management is costing the selected and quantified essential drug. You have selected, you have quantified the doses you wanted. The next is costing it in terms of price. Costing has to do with you calculating the total expenditure that is associated with you acquiring those drugs. So in this particular level or step, you will have to look at what each of the drugs cost. You have to obtain the price from the supplier or medical central store. Then you calculate the total cost by multiplying each drug's price by the total quantity required. Then you come up with an overall budget. Then once you have been able to cost the selected and quantify the essential drugs, the next is ordering of selected drugs. Then once you have calculated it and you have the money, the purchasing power, then next is for you to make an order of the drugs. And this can be done through a lot of methods. Then once you have ordered for the drug they will not send the drugs to you. You receive the drug. That's the next step in essential drug management. You receive the drug and store the drug. However, this will be taken in other section, but the focus of today's lecture is on selection. So once you have received the drugs and stored them, the next is distribution, that is giving out the drug, dispensing it, prescribing it. So all of the above make up the essential drug management. So see, selection of drugs that are essential, quantifying selected essential drugs, costing the selected and quantified essential drugs, ordering of selected drugs according to the required quantities and ordering interval. What we mean here is that some persons order 6 months, some people are on yearly basis. Then receiving and storage of those drugs. Then the last is distribution, which includes you issuing out the drugs, inventory control, prescribing, dispensing, and use of drugs in a rational way. Let's move into the focus of today, which is selection of essential drugs. The selection of any pharmaceutical formulation should be determined by its effectiveness, safety profile, cost consideration, method of administration, and the specific health requirement of the patient. So, this selection of drugs can happen at national level and at community level. At the national level, it has to do with selection of list of drugs that are of or that are drugs that are much needed in that country for the management of their condition. Then, when the drugs enters, different communities have different or peculiar health problems. So at the community level, there are some list of criteria you have to consider before you select from the list of national drugs that are needed in that particular country. So let's look at criteria for selection of essential drugs at the national level. At the national level the list is based on essential drugs considered to be safe, cost-effective, and must be in the generic name. First criteria that is considered is it must be efficacious. It must be efficacious. Now, efficacy refers to the ability of a drug to provide the intended therapeutic effect. When we talk about efficacy, we're looking at the ability of that drug to treat that condition. If a drug does not fulfill this purpose, then the drug is not efficacious. So when we look at efficacy, we're trying to understand that that particular drug must treat that condition without causing harm to the patient. Because we know that efficacious drugs can reduce disease cases and even death rates. So, however, in a particular nation, there are regulatory authorities like in ours. There are Food and Drug Administration, NAFDAC, that look at these drugs before they are approved to be selected in the National Essential Drug list. Another criteria that is considered is the drug should meet up the healthcare need of the majority of the people. That is, the drug must serve the condition. Like let's say in a particular country, they have about 20 diseases that are endemic with them, they are living with. At least all that diseases, at least 90% of the disease conditions, the drugs should be procured, should be in the national list. And these drugs must be made available to address this common problem, which could be infectious diseases, can also be chronic illnesses, such as malaria, diabetes, high obesity, and all of that. So it's also a criteria that is used in selection of drugs at the national level. Another criteria is that the drug should be in dosage forms acceptable to the people and should have a reliable shelf life. Dosage forms include that drugs can come in dosage form like syrup. It can be in form of syrups. It can be in form of injectables. It can be in form of tablets. It can be in form of capsules. Any of these dosage form must be user-friendly and culturally acceptable by the people. This could mean that the form which the drug comes should be in a way that it should be able to swallow it if it's for capsules and tablets, or convenient to be administered to the patient. For example, pediatrics, you must consider pediatrics that they lack the ability to swallow. So any of their drugs should come in a form that can be administered. You understand? Then talking about reliable shelf life, we try to mean that the drug should be able to maintain a level of potency and safety over time. So that it's not when you purchase a drug, within a few days or the drug has already deteriorated. Another criteria is quality certification should be readily obtainable. This criteria try to let us understand the importance of having a consistent quality assurance system so that the drugs that are being produced are safe and efficacious. So that when people buy this drug, they consume it, it solves their problem, they would trust the healthcare system. As such, those quality assurance systems that are put in place, like the NAFDAC, the Standard Organization of Nigeria, Nigerian Medical and Dental Council, and other regulatory authorities, would help reduce, the Pharmacy Council, would also help reduce the risk of having a counterfeit medications, which can be dangerous to the people. So when they pass through this rigorous process, the chances of having a counterfeit drug would be reduced. Another criteria is the drug should be, as far as possible, being able to be manufactured in the home country. Because when a drug is being manufactured in the home country, people can have access to it easily, not waiting for importation and all of that. And that reduces the cost of buying it in dollars. And also help in boosting the economy, since people are always buying for them because it's a consumed product. It also minimizes the reliance on importation, which can be affected by international supply chain issues, tariffs, and other barriers. So therefore, any drug that will be in a national list must be a drug that that country can be able to produce, so that when they have a public health emergency, they can easily access their drugs without waiting for importations or relying on the other nations who might also be facing their own internal challenges. Another criteria is the drugs should be in generic forms. That is, the drug's name should reflect the ingredients. So generic drugs contain the same active ingredients as their branded counterparts, but are typically sold at. So when we try to consider this criteria, we try to look at that the drugs should be sold with their generic name. As such, that would improve accessibility and affordability, and also making the treatment effective. So that is one of the criteria. Drugs that contain the same active ingredients should have similar names. The next criteria is single drug formulations are mostly preferable. That's the criteria. Single drug formulations, such as also known as monotherapy, are usually preferred over combination therapies. Because when you give one drug, I know this is a monotherapy, you can easily administer the drug, utilize the drug, and monitor the drug's effects. As such, would help reduce the risk of drug interactions and also simplify prescribing practices and pharmacovigilance. And also that would also make the patients to adhere to treatment easily. So that is one of the criteria. So these are the criteria that are being considered for selection of drugs at the national level. Then at the community level or health facility level, the following are considered. One, training of the personnel in charge. Two, prevailing ailments. Three, type of health facility. Four, genetic and environmental factors. Five, demographic factors with respect to the community. Now let's look at the number one, which is training experience of the personnel in charge. You have to also consider the healthcare personnel in that particular facility. If it's a doctor, the doctor knows the level of drug they can use. If it's a J2, a junior community extension worker, there are level of drugs they are expected to use. The same way for community officers, CHUs, and other healthcare or pharmacists. So that is very important. This is because each level of training has a level of understanding of specific drugs, their efficacy, their safety profile, their dosage regimen, and possible interactions and contraindications. So that when they choose those drugs, they will know that I'm aware of this drug contraindication, the dosage, the efficacy, the safety profile, so that when they prescribe these drugs to the community member, the community would use a safe and effective drug. So the knowledge of the healthcare worker in charge or health personnel is an important factor to be considered in selection of drug at the community level. You don't go and use drugs that are higher than you. The next is prevailing ailment. You must consider the common diseases or health conditions in that community before you determine the drugs that are essential to be used. As such, you have to consider the epidemiological data, that is the prevalent disease, the morbidity pattern, the mortality rate. You're also going to consider that. Then you also have to consider the culture and social context in that particular community before you select any of the drugs that will be used. Another is type of health facility. Like we said earlier, some health workers are meant for primary care clinics, some doctors, hospitals, specialist hospitals, health posts for junior community essential workers, primary health clinic for community essential workers, nurses, community officers, comprehensive health centers, and all of that. So each of these facilities have list of essential drugs meant for them because certain drugs require specific conditions for it to be kept safe without undergoing deterioration during the process. So that is why at each level, at help when you are working at the grassroots level, like the health post, there are series of drugs that are required. When you move down to health clinic, there are series of drugs. Move down to comprehensive health centers, there are list of drugs. Then when you move down to hospitals, there are a list of drugs that are expected to be found. Then pharmacy, a big pharmacy or specialist hospital, there are a lot of drugs that are expected to be seen there. This is because at each level of healthcare delivery or health facility, there are a level of care offered there based on their capacity in terms of diagnosing and treating conditions. Another factor that is considered in community level is genetic and environmental factors. Genetic predispositions to certain diseases and environmental exposures can significantly impact on the health outcome within the community. Therefore, must be considered in drug selection. When you understand the genetic makeup of the population, it can help you in identifying variation in drug metabolism, efficacy, guiding the choice of specific medications that are more likely to be effective. When we look at genetic, we're trying to look at some persons based on race are more exposed to G6PD, glucose 6-phosphate dehydrogenase deficiency. That condition, which is an enzymopathy that leads to hemolysis. That condition, there are a lot of drugs that can precipitate the hemolysis. Some anti-malarials, some group of anti-malarials can predispose to that G6PD hemolysis. As such, must be considered. So when you are selecting those drugs at the community level, you have to consider, these people in this community, are they predisposed to G6PD deficiency or any other enzymopathic related condition? There are lots of them. You will have to consider that before you make final selection of drugs you will be needing. Then you have to look at environmental hazard as well. You have to look at environmental hazard as well. The environmental hazard we're talking about here is pollution, exposure to pollution, occupational hazards, and diet that people consume if they are also involved in exercise. These environmental factors we are talking about have the potential of increasing certain diseases. As such, you must consider those environmental factors before you can choose series of drugs that are necessary. Now, also look at environmental hazards or environmental factors. So in certain area, whether if it is rural, are much exposed to certain diseases. Take, for example, the environment that you see more of venoms, like venomous animals, like snakes, some areas that are more of scorpion and lights like that. So you have to consider this before you now say, these are the list of the drugs we are going to be using for treatment. Then another factor you consider is demographic factors. When we talk about demographic factors in that community, we are trying to look at the age distribution. We have people at different age group, infants in that community that are infants, children, adults, and elderly. These age groups require different medications because of what is known as age-related vulnerability. So you must consider it. Like for example, you must consider pediatric formulations. You must really consider that, and also geriatric formulations because geriatric formulations because pediatrics may not may may not metabolize drugs faster. Geriatric may also not metabolize water-based drugs. There's drugs that are water soluble, but may metabolize. I'm just giving an example. May metabolize drugs that are fast soluble. Elderly may have poor regional blood supply, whereas an adult that's within the working age may not really face such challenge. An elderly may have reduced renal function or may have renal insufficiency. As such, may find it hard to excrete some certain drugs. So these demographic factors based on age must be considered. Then also you have to consider the socioeconomic status in their community. Can these people be able to buy these drugs? You have to look at the cost-effective part of it and the affordability by the community members. Then you have to also look at the culture and ethnic consideration. The community are something that have a particular belief about disease and certain drugs. You also have to look at their impact. Because if they have this belief that disease condition comes from God and it's a way of punishing man, it automatically means that they may not really make use of the drugs or come to facility. Even when they come, when you prescribe, they may not really go with that. They go and do their normal rituals. As such, the drugs would expire without serving the needs for which it was meant. So these are the factors you have to consider at the community level before selection of drugs. Now, let's look at methods of selection of essential drugs. One of the methods that are used for selection of essential drug is the ABC value analysis and the VN system analysis. Let's look at the ABC value analysis. The ABC value analysis is a systematic approach used in drug selection that helps us in prioritizing medication based on the value and utility specific to a healthcare level. This analysis focuses on categorizing drugs into 3 categories. This ABC value analysis categorizes drugs into 3 categories, the A, the B, and the C, according to the importance or the demand by patients or treatment effectiveness or cost effectiveness or clinical relevance. So it's trying to categorize drugs based on A, B, and C, basing it on demand by patients, treatment effectiveness, cost effectiveness, and clinical relevance. So we're going to look at the first category A, known as high-value drugs. These are drugs that we consider essential for treating more of the conditions within the community. And as such, these drugs must be available always. So what are the characteristics that would make you say this drug belongs to category A or it's a high-value drugs? One, the drug must be in high demand. due to prevalent diseases. For example, diarrhea is going on. So one of the A category should be ORS, zinc, because this drug is the drug should be needed in a high level because of the prevalent nature of diarrhea in that community, or because that diarrhea is endemic in that community. So for you to consider a drug a high category, the drug should have high demand due to prevalent diseases. Then another characteristic is that the drug should be proven effective and have safety profile. When you look at ORS, it is very, very effective in management of diarrhea. And the safety profile is there. Nobody, I don't think the number of persons who have reported adverse events or adverse drug reactions following ORS is, if there is, I don't know. So the drug should be proven effective and have a safety profile. Then the drugs also should be cost effective. If you look at ORS, it's very cheap and the people can afford it. Then the drug should generally be recommended in treatment guidelines and health policy. If you look at the national standing orders and other SOP documents, ORS is highly recommended. So these are the characteristics of drugs that must be included in category A under the ABC drug analysis. Now let's look at the category B, that is drugs that are moderate value drugs. This group of drugs are useful, but not critical for the majority of patients. That is, they are useful, but they may not be needed much in the treatment of patients on a daily basis. And these drugs may be included based on specific circumstances or less common conditions. And what are the characteristics that qualify this set of drugs? Drugs that are of moderate demand and are used for specific medical condition of population. You know. Secondly, the effectiveness of the drugs may be significant, but the drug may have issues with cost, maybe a little bit higher, and may have side effects. This set of drugs are also all prescribed, offered, given, chosen as a second-line treatment option. So drugs that are categorized as group B or moderate value drugs are drugs that have moderate demand, or drugs that are being used by specific population like pediatrics or patients that are having sickle cell anemia, or pediatrics that are suffering from hemophilia, or pediatrics that are suffering from one of the, or elderly persons that are suffering from one condition that is specific to them. Then the drugs are effective, but may have significant cost, like very, very expensive, or side effects. We still need them, but they're under category B. Then the drugs are often prescribed as second-line treatment options. Another category is the category C, known as low-value drugs. These are drugs that often offer limited therapeutic value. And sometimes their effectiveness are questioned. And sometimes they may be harmful when used in certain age group of population. So such drugs are of low demand and are not commonly prescribed, or sometimes they are ineffective. So these are where drugs are categorized according to ABC analysis, so that when you are selecting, you select from the A, you select from the category B, you select from category C, for you to have a good capture of the drugs that meet the healthcare demands of that population. But however, it is important for us to note that before you can effectively implement the ABC value analysis, you need to have a comprehensive data collection. You have to have an accurate and up-to-date drug utilization pattern in that community. You have to have it. You also have to know the diseases that are common. You also need to know how, if these drugs are actually treating that condition. Then you also need to know the patient demographic, the age distribution, and all of that. You should be aware. Then you also have to have a multidisciplinary collaboration with other healthcare workers, doctors, pharmacists, healthcare administrators, public health officials, community extension workers, officers, nurses, midwives. You have to have that multidisciplinary collaboration. Then it should be evidence-based. There should be evidence-based guidelines so that you will not be making mistakes. So like the standing orders have list of drugs that are meant for this primary healthcare level. So you have to consider that. Then you also have to consider cost effectiveness analysis. You have to do a thorough review of the cost of the medications in relation to their effectiveness in improving the healthcare of the people. Then you also need to do community health need assessment, such as community diagnosis. You must have done community diagnosis, situation analysis, for you to know the prevalent diseases and risk factors that is important for you to select those drugs that meet the health challenges and demand in that community. Then you also have to have a good understanding of the regulatory and policy support. You cannot go and purchase a drug that the country does not approve. So you also have to look at local health regulations and policies before you can use the ABC value analysis. Then training and education, you also have to look at the training and education level of the health workers you are working with. So these are the conditions necessary for the implementation of the ABC value analysis. Now let's look at the other methods using drug selection, known as the VEN system. The V stands vital or potentially life-saving drugs. The E stands for essential drugs that are essential drugs that are for less severe but significant form of illness, while the N stands for non-essential drugs used for minor self-limiting illness. Now, the vital, these are potentially life-saving drugs that are important in treating life-threatening conditions. So all those emergency drugs that were necessary, adrenaline, asthma drugs, and all of that, hypertension drugs, are considered as vital, potentially life-saving drugs. So vital drugs are those that are essential for the immediate preservation of life, especially those drugs that we use in emergencies or in critical care situations, such as the adrenaline, like I said, insulin for diabetic patients, and drugs such as atropine used for cardiac arrest. These must be included under vital, potentially life-saving drugs. And as such, this set of drugs are used in acute care settings, such as emergency departments, intensive care units, and all of that. Then the next method is essential. Essential drugs are those that are necessary for treating basic health problems and maintaining health in population. These drugs are used for treating less severe conditions that may not be life-threatening, but if not treated, can lead to serious complications. Examples include antibiotics, antihypertensive medications used for managing high blood pressure, and analgesics for managing pain, and must be selected. And also, one thing about these essential drugs are their payments are not actually, the cost of the drugs are not high or exorbitant. Then another level is the non-essential drugs. The non-essential drugs are those used for treatment of minor or self-limiting illness. So what it means is that whether you give drugs or not, some of these conditions will resolve on their own. Example of those drugs includes antihistamines that are used for allergies, like common cold and catarrh, topical hydrocortisone cream for minor skin irritations. Sometimes they, on their own, those irritations, allergies may resolve on their own. So this is the two methods most common for selection of essential drugs. There could be other methods, but for the purpose of our discussion, there are two methods that are used for selection of essential drugs in primary healthcare system, known as the ABC value analysis and the VEN system. In this section, we've been able to make you understand, introduce to the concept of management of essential drugs, then discussed on selection of essential drugs. We've been able to, and we looked at the two most common methods that are relevant to our system. I hope to see you in the next section.